Okay, let's talk a little bit about the importance of the initial evaluation and its wrap-up at the end, okay? This is a really important part of the course of therapy for a patient because so many things are gone over at this time period that are very, very important. So you are in aid and the patient has wrapped up. They typically come off, electrical stimulation or something like that, and now they're coming to you. The therapist has gone through their plan of care, explained everything that went on during the evaluation, and everyone's all on the same page. They got a plan of care set for a certain amount of visits and how many times per week. And then they're coming to you. There's going to be a checklist of things that you need to kind of go over with them that is really, really important. But just kind of take a look at it more globally. This is the wrap-up of their plan of care, okay? If we can get everything done well at this portion of the initial evaluation, then it eliminates like 90% of the problems that come on down the line, okay? If patients have an understanding of what therapy is going to be, they've kind of got that from the therapist. Now you're there to kind of get them in the schedule and explain everything to them. So you're going to go through things like the explanation of benefits and scheduling them, and those things are very important. So we talk more in depth about the explanation of benefits and what is included with that. But it's important that you ask if they have any questions on that. Okay, it's very confusing, just like we talked about in the past, and we want to eliminate all confusion right at that first visit. Okay, again, if we do a good job here, then we don't have problems down the line, most of the time. But if we miss a step in here, that's where confusion comes up, and then the patient does have an issue down the line. So really be thorough when you're explaining everything and talking to the patient. And so again, with the explanation of benefits, and then with scheduling. So we schedule our patients out. This is important. So the therapist has given them a prescription for, their kind of idea of what therapy is going to be. And they are prescribing treatment, okay? So this is what I think is going to work best for you to get over the issue that you're having, okay? So it's important, we tell all of our patients to schedule out their appointments for that time. Or say, I think it's going to take, 12 visits or 14 visits, 3 times a week for the first 3 weeks, and then 2 times a week following that for 3 weeks. I want you to schedule that out. Again, if you got like a prescription for an antibiotic, you wouldn't take 40% of it, or I'll take some of it now, and then eventually I'll take some of it later. You're going to use all of it. We're going to do the same thing with physical therapy. We're just going to schedule that out and make sure you're on the schedule for that time period. So make sure that you're doing that. This, again, solidifies the patient knows, like, all right, it's going to take a certain amount of time for me to get over this. There's a plan. It's a specific plan that's in there, and the patient also gets in the schedule. That's really important because if a patient tries to schedule the week of, it gets really challenging if the schedule is tight. So we always tell patients that as well. I want you to get in the schedule, but go ahead and schedule out. If you schedule this week, it might be tight, but if you schedule 2 weeks from now, you can pretty much have any time that you want. You want to make sure that that we're talking to them about that, and know that they can always change the appointment. Okay, if they got to change something down, we can take it, we can move it, or if they were completely successful with physical therapy, we just take those appointments out, so you don't have to come in like for those appointments. But at least it reserves their spot and gets them in the schedule. So that's an important reason to get the appointment scheduled out. You really want to talk with them about their any questions that they have. So again, we want to answer all questions at this first visit to our office. All right. So you should never end this interaction by saying, "Do you have any more questions? Is there anything else that you need to know? Anything else that I can tell you about the treatment or the schedule or your benefits or anything like that?" I want to make sure that we have everything explained to you as best we can. You can always ask questions in the future, but if there's anything right now, I want to clear it up for you, okay? So that should be the end of that interaction, is like, do you have any more questions about anything that I can help you out with? And when they say no, say, all right, well, you may have questions in the future. Make sure you're asking us, okay? Communicate with us. Let us know if there's anything that you need or that we can do. But if we do a really good job of wrapping that up and just setting that way, we've set their plan of care in motion. Like, all right, we've got it set. This is our plan. This is what we're going to do, and we're going to get you better. If you come in for your appointments and do everything the therapist says, then we're going to be good, okay? So make sure you're doing that, and getting everything answered at that first visit is very, very important.